and we're seeing younger men complain of symptoms of low testosterone.
You got to focus on those symptoms, and even if you get a number that's lower on that piece of paper because the time between your applications was longer, you still have more than enough testosterone. Budding population of men that are sick and poisoned, and as I've said, by the toxic environment that we are in.
And that women also produce testosterone, and how much transference would there be?
I'm not seeing any significant issues with transference. I just have found that the 5-hour mark from a clinical standpoint is what correlates.
It does not mean if you were to measure the area under the curve all the other time.
I don't see a man any day of any week of any year with estrogen symptoms, for instance. We don't see those.
You know, we've been doing this for a long time, since 2016, using the creams in some subset of patients, and we kind of run into the same things here. And it's important for people to be reassured that, you know, just because it's run out, you're not going to go back to the hypogonadal state, because people forget, even if they see a slightly lower level on the blood test, that when you're on your own, under your own steam, under your own testosterone, and it's deficient, you're always like that. But one blip on a blood test, it does not mean, if you were to measure the area under the curve all the other times, you have more than enough testosterone compared to where you would have been before.
Right. What we see clinically, I'm sure that you do, is not what you read on forums and internet.
Yeah.
What you see in a clinical practice, we don't see those men with all these complications. I don't see a man any day of any week of any year with estrogen symptoms, for instance. We don't see those. Yes, we all see hair loss, we'll all see acne here and there, but the side effects from testosterone are not very common. The most common are going to be acne and hair loss, things like that. But we don't run into, our days are with dealing with men that are having improvement in their parameters of health and in their symptoms of a deficiency, not dealing with problems like these guys on the forums and the internet. So missing a dose or two, you're not going to notice at all. And so when we go into the cream, we talk about that. All right, so you asked some men, most men do it twice daily. That is not a rule. That is not written anywhere that it should be done or has to be done twice a day. That's just what I have found works best for most men from a clinical standpoint. When you hear me make the statements, most men, I'm not saying every man. I have a few men that only do it once a day, and they feel just perfectly fine doing it once a day. And these are the 3 reasons that I get for doing it once a day. Doc, you know, my schedule's really crazy. It's busy. I'm working 2 jobs. I'm just, you know, I want to do it twice a day, but I forget so much, and I'm usually out of the house, for 16 hours. Yeah. So, but I feel really good, by the way. Can I just keep doing it once a day since I feel so good? Yes, you can. Reason number 2, Doc, you know, I have no problem doing it when I get up in the morning. That's easy. I'm going to go to work. But look, I don't want to have to worry about it a second time during the day. You know what? I'll just admit it. I'm just too lazy to want to have to do it twice a day. Guys have really said, I just don't want to have to worry about it. I admit it. I'm just too lazy, but I feel good. Then okay, keep doing it just once a day. And then the third reason is a lot of men have a great deal of fatigue, and the testosterone is really giving their energy back. And they complain that when they apply it in the evening, that it tends to interrupt their sleep. And so they just feel better doing it once a day. So that's perfectly fine to do it. You just have to, once again, raise levels to avoid symptoms. To resolve symptoms and avoid unwanted side effects. Yeah. It doesn't have to be complicated, because it's not complicated. It's a very simple process. It is a very simple process that is made complicated by those that have a financial gain off of making it complicated, but it's very easy. So we've applied it twice a day, avoiding bathing, showering, or swimming for at least, 4 to 5 hours after applying it. If they miss a dose or forget a dose, and I tell them all the time, don't worry about it. Don't stress over it. You won't feel or function any differently. You don't need to double up at your next dose. Just pick it up where you left off.
That sounds right. Well, what about having sex with your partner? Should you?
Let's go through that. Okay, so we've applied it twice a day. We're keeping it on there as long as we can. Okay, there's only one potential downside of the cream compared to injections, and that is the potential for transference. Now, of course, transference does require skin-to-skin contact.
Yeah.
Now, we use that scrotal application, Mike, for 2 reasons. Number 1, we typically get our best levels applying it to the scrotal skin because it's thin-skinned and highly vascular. As I have said before, You can apply this cream anywhere that you have skin from head to toe, face, chest, shoulders, inner thighs, top of the foot, anywhere that you have skin. It'll work. But the scrotal skin will typically give most men their best levels, but more importantly, it reduces our risk of transference.
Well,
So since, since transference requires skin-to-skin contact with a scrotal application, we should have completely eliminated any risk of transference to children or
yeah,
animals. So we're talking about our sexual partners. How do we avoid transference with them? 4 ways. Number one, wait 5 hours or longer after you apply it to have sexual activity.
okay,
Number two, just wait till after sexual activity to apply it. That's so easy to do. It's what I do. Number three, at any time after you apply it, you want to have sexual activity and reduce any risk of transference, simply go into the restroom, take a towel, soap, and water, wash off the application site. And then number four, many people, many couples, due to kids or their schedules, are very scheduled with regard to their intimacy. If it happens to be that night or nights that it's always going to occur, and you don't want any risk of transference, you simply don't have to apply it at all. You once again will not feel or function any differently. And then there's a number five, but it's not. Anytime you start applying the cream at night, you should sleep with some form of clothing on your lower half, so as not to have any, chance of any sustained skin-to-skin contact with your significant other and be sleeping over with you.
I mean, there's also the consideration that women also produce testosterone and how much transference would there be. I used to make the joke, I don't know if it's just quite crude, that, unless you take the phrase going balls deep literally, maybe you won't actually get the transference that you think.
Yeah, it's wonderful that you brought up that story. I haven't mentioned this in a long time. And once again, I
Yeah,
failed to mention it when I talked about this with Stephen Devos, Dr. Devos. But look, uh, I treat many couples. I treat men and women. I'm not just a men's clinic.
yeah,
I treat just as many women as I do men. So many of those couples are both on testosterone. We know that. And many of those couples come back and say, "Look, doc, we don't take any precautions anymore." And I don't tell them not to. They just look, we
yeah.
don't care. We blah blah blah. And so I'm not seeing any significant issues with transference in those couples for the exact reason you just mentioned, because there's not a lot of sustained skin to skin contact with that scrotum, even during intercourse.
Yeah.
All right. So, but still, once again, we tell them how to take precautions, and that's how you do it. And the way you would know if your significant other was typically getting too much without measuring blood levels,
Yeah.
they would probably complain of some acne, maybe getting some pimples they normally didn't have, or maybe some increased hair growth. That's how you would normally see it. We don't really see it as a part of my clinical practice. Once again, I don't treat typically men under 30 unless they have a diagnosis of hypogonadism. And the only reason that is that it's this reason, is that that age group would rather get their information from Reddit
Hmm.
and, the forums, and rather than truly follow evidence-based medicine. And sometimes following evidence-based medicine runs counterintuitive to what they think makes sense. Like the whole estradiol management issue, what the medical literature actually shows and what actually works is counterintuitive to what seems to make sense to them.
For younger patients, I just, with all the talk of environmental toxins, and we're seeing younger men complain of symptoms of low testosterone. What did Jay Campbell mentions, like the soy babies or soy
Right.
boys,
Right.
and I mean there might be a growing group of patients that
Oh, that,
are you seeing them come to your clinic?
oh
Because we're
yes,
seeing younger and
absolutely. There
younger.
is a dramatic need. Oh, they are a poisoned group of men that has a big need. But once again, it's not that they don't have the need. There's plenty of middle-aged and older men that need all of our help. They are a budding population of men that are sick and poisoned, and as I've said, by the toxic environment that we are in, and that they have been exposed to since being in utero. The problem with treating that group of men is the difficulty because of the social media presence, and they would rather get their information from like I say, Reddit or Excel mail than from what you're trying to teach them and tell them. Whereas the men that are 40 and above or so, they'll doc whatever you say. I mean, they'll do a little research, but they kind of can understand evidence-based medicine, and not going with what their buddies on
Fair
TikTok
enough.
said. You know.
Yeah, no, we see that some of that too as well. So, oh, that's
So
That's
when it
yeah.
comes to measurement, you mentioned this earlier, which is a great question. You got so many great questions when it comes to that. It shows that you've really put a lot of thought and into what you're about to do with the cream over there, and I'm so glad to hear it. Music to my ears. But look, I like to measure at the 5 hour mark. That's not written anywhere. Why? I've measured it at all time frames.
Right.
I just have found that the 5 hour mark, from a clinical standpoint, is what correlates with symptomatic improvement and levels the best. Men see a level they like, their symptoms are improved,
Yeah.
they mesh very well together, if that makes sense. Because, as I've said before, if a man sees a low number, even though he feels great, it's going to make him not feel great because he's going to let that number dictate how he
Yeah, that's
feels.
true.
If he sends a really high number, then he may fear it for some reason. So that 5 hour mark is a really good mark that correlates well with symptomatic improvement and levels that are pleasing to the patient. And I like them too. But you can measure it at whatever level that doctor wants to measure it at.
So
But I keep hearing this. Well, the cream has a 12-hour half life. No, it doesn't. It's not a 12-hour half life. There's a 25% decrement after peak absorption at about 12 hours, about 25%.
one of the things we like to do at Balance our Hormones, and our doctors do, and I think that the logic behind it is because we want to make sure that before the next application, the patient isn't too high or too low, and it gives them reassurance. But I do understand where you're coming from about the 5 hour mark. So we'd measure them if they're doing twice a day at 12 hours, if we could get it to match with when the lab is open. Or if they're doing once a day, close to the 24 hours within a couple hour window. But yeah, we have seen, higher levels, and obviously even with, injections, patients will say, because it goes over the range and the ranges are artificially lower and don't always take into account the person on TRT, and they'll say, "Oh, you're overdosing me," or "I'm too high," and you
Right.
have to remind them, that we've seen some patients who don't qualify for a TRT who've had levels higher than that.
That's right.
Obviously, there's caveats where some patients will have a high SHBG to match, and that could be
Right.
another story. And so it's really hard. You've got to educate them that it's
Right.
not just that number and how it goes along with the reference range at the lab, because they don't. They're not always fit for purpose, these reference ranges.
Right. Well, you brought up some really wonderful points in there. Let's talk about those. So when it comes to injections, everybody was taught to measure at the trough. Well, why is that? Because they don't really want to see what the peak level is.
Yeah, that's
If you
true.
inject 200 milligrams in some men, like I said, you're going to be 3,000. Yeah, I've seen it 3 to 4,000 in a man, just if you measure it at peak absorption. So we're taught to measure at trough. They want to
Yeah.
see it at trough. It makes them all feel better. So they make their adjustments off a trough. With the cream, there's not really much of a trough at all.
Well, it's just a
I mean,
short window.
it's a
Yeah.
nice little sine wave of levels. And so I think it's very important that when it comes to the cream, that they understand that when it comes to measuring levels on cream, that your morning application rides on top of your evening application. Your evening application rides on top of your morning application. So for me, since I do a twice daily application, I get my levels 5 hours after I apply it in the morning. Well, when I see some men come in, let's just say previously their levels are, let's just make up numbers, 1,500. That's just an easy number to always make up, 1,500, or I could do 1,000 if it makes people feel better, but let's just say it's 1,500. And then the next year I measure their labs and it comes back at 700. Well, almost every single instance, that person didn't apply their evening dose. They forgot to do their evening dose before their morning dose. Also, when it comes to the cream, understand that timing of application between applications is going to make a difference in your labs. So we always have to focus on symptomatic improvement first and foremost, not some slight variations in their lab number. Because, for instance, if we applied exactly 12 hours apart every day, if we lived in a vacuum and we could just literally do it like that and then get our labs exactly 5 hours after, you and I are going to have a number. If you and I, for whatever reason, that day we got busy and we applied it at 10 hours apart and then get up the next morning, now it's 14 hours apart because I applied it 2 hours early that evening. My number is going to be different on a piece of paper. But as you mentioned earlier, so wonderfully, that look, you got to focus on those symptoms. And even if you get a number that's lower on that piece of paper because the time between your applications was longer, you still have more than enough testosterone to saturate your androgen receptors. And what you just brought up was something that men need to truly understand. So, Mike, we all know that, and I hope this might be a little controversial topic, but it's a true topic because it leads into your statement of the androgen receptors being fully saturated. Number one, there is a saturation point to the feel-good effects of testosterone. Absolutely. I mean, there is a saturation point because once those androgen receptors are fully saturated, you can't stimulate the receptors any further. They're fully saturated. So there are no more feel-good effects past a certain point. Bodybuilders use it in really high levels because in the muscle tissue, the androgen receptors are upregulated. So you can keep building lean muscle mass by increasing your androgen levels. That's why we use multiple anabolic steroids. But as far as the feel-good effects go, they're not upregulated. So when their symptoms of a deficiency have resolved, raising levels any further will not make you feel any better. You'll see guys on forums all the time. Man, I just feel great, but man, I don't have any symptoms. I feel great. Maybe if I raise my levels, I'll feel greater. Well, if you really think about it realistically, when does that end?
Yeah.
Great to greater. Now you're greater. Are you going to be greater? I mean,
It's just getting greedy at that
from a
point.
physiology standpoint, there's a plateau to the feel-good effect.
Yeah.
Okay. Many clinics, and there's nothing wrong with this. Let me make sure I explain this very specifically. Minimal effective dose. Yes, that means we'll give you a minimal amount of testosterone to raise your levels, the minimal amount to improve your symptoms. That is absolutely sound medicine. That is wonderful. That there's nothing wrong with that. But then if you ask a man, well, do you want the minimal effective dose or is there a dose that will actually give you more benefit or the maximum benefits with regard to testosterone, with regard to increasing lean muscle mass, strength, endurance, exercise tolerance, bone mineral density, healing time, decreased, recovery time, decrease in body fat is related to a dose response as well. So the better the levels, the better the benefits. And every single man that I've ever talked to will say, well, doc, I want both. Okay. Because 70% of your insulin sensitivity is related to your lean muscle mass. So the more increased lean muscle mass you get, and the more decrease in your visceral body fat, which is responsible for at least 12 different cancers. So the point that I'm making is what you also mentioned that you didn't realize about studies, about the Traverse study, where we only gave men jail, raised their testosterone levels a couple hundred points. Well, some men will feel better there, but you're not going to be as good as a man that has a level maybe double that, because we're going to decrease that visceral body fat in a dose response manner. We're going to decrease the subcutaneous, visceral, we're going to increase the lean muscle mass. So every man that I ask, do you want both? They want both. And with that said, so therefore, they're running above the minimal effective dose. So like you've said previously, if they miss a dose or don't get a dose, they still were running in excess. They're not going to notice it or feel it at all when you do that. So there's little nuances with regard to clinical practice as you're seeing. And then people ask, well, when's enough enough? Well, I've said this out loud. I found that saturation point is with the free testosterone, 30 to 60 nanograms per deciliter, which is typically going to be 1,000 to 2,000 nanograms per deciliter total. And so when I start seeing, people's free testosterone levels getting 80, 90, 100, that is excessive. That's where we're starting to get into that abusive territory. So there's a testosterone dose where you, once again, minimal effective dose, low levels, and I feel a little bit better. There's that optimal level, so we're really talking about optimization. That's the optimal levels. And then there's a level when you start getting into it purely for the performance enhancement characteristics, that's when you kind of cross the line.
If you like content like this, do click like and subscribe and hit the notification bell if you want to get our latest updates for when we drop content. It really does mean a lot. And until next time, to your wellness, this is Mike.